Big breath in and blow it out. And let this jiggle like this.
Oh. Oh.
Got it.
Oh my God. Oh.
Here goes the
Yeah,
front
I
one.
felt that. What? Wow. That's like, that is so different.
Okay, so we have Dennis here today. Dennis lives close by and he brought his dog in. We just did an adjustment with Gummy the dog. But today we're working on you. And you have some issues with the left shoulder more recently, right? Where it's just kind of tight in the front.
Yeah, hard to lift up.
And you do boxing workouts
Yep.
for conditioning. And then once in a while, you said your lower back hurts.
Yeah, my left lower back kind of like pull and I can't really bend over too far at all.
And then you were also curious about the craniofacial release.
Yeah, so
Okay.
I think I have like pretty intense sleep apnea according to my wife. So yeah, I just kind of wanted to never really address that.
You know, sleep apnea does respond to the CFR. I don't know if I've ever 100% cured one, but we definitely improve it. For example, this one guy that comes in has a sleep apnea machine that lets him know how many apnea episodes he might have in a night. And he was averaging up to 20 episodes on average.
Oh, wow.
So 20 times in a night's sleep, he'll like, stop breathing, right? And then after the CFR, he had it down to about 3 to 5.
Oh wow.
Which is much better if you think about it, right? So that's good to lessen it.
Oh,
And he
okay.
wound up only doing about 4 treatments. I really would have recommended 8 to 10 with a case like that, but he might be coming back, but he was from out of town, so he did the best he could. But we've also had other sleep apnea cases, again, that had improvement, 40%, 80%, 90% improvement, and that's always good. I'd love to see one day maybe we have a case that just totally gets resolved. But we also had this one other case that the patient was not on a machine yet, because it only was a little bit randomly, and now it's such a small case now that the doctor doesn't feel that they might need to go onto a machine, and that they'll be okay just with the oral device. So that's kind of a cool step too, that he doesn't have to escalate into the all-night PAP machine. Okay, so let's get started. Let's check some range of motion. We're going to start on your good side. I know that's your good side, so don't think I forgot. Thumb is up and head is up too. And we're going to just laterally bring the arm up. And notice the arm comes to the top. I'm holding a shoulder blade down, which is really good because we don't want him to recruit a shoulder blade. I don't love the range of motion this way, but it might be his normal. So typically if we spin him this way, and he's a young guy, this arm should come behind his ear, and you're cheating, and it almost gets there, but it's not great. Now he might say, I've always been tight in my shoulders. Have you? A little
Yeah,
bit?
always been pretty tight.
Yeah, but let's see the left side now. And this is the side he's had some issues with. So now I'm gonna bring the arm up, and it already feels locked by here. Do you feel the difference?
Yeah.
So on this side, it comes to that spot, but keeps floating through. So here's 0 degrees, here's 90. Between 90 and 180, it's a little tight, but it comes up. And we get it to 180. This side did not do that. This side is 0 degrees, 90, and by here you failed the test already. So let's work on him a little bit. So right now I'm on his latissimus dorsi, where it connects in. And doesn't it feel horrible? So head up though. Good. And there. So your left, this is part of it. And you might have heard this in the gym actually.
I think so.
Now I'm gonna lift your collarbone a little bit.
Okay.
Sit up tall. You try it.
What? Wow. That's like, that is so different. What?
Isn't that cool?
Is that,
So now-
is that magic?
Yeah, it is magic. Lie on your back. And I'm gonna put this up here.
Oh.
Big pop
Oh.
to put the shoulder. And now let's try it.
Wow, it's like no pain at all when I do that.
And
It's
it
like
even comes back better
yeah.
now.
It's
Better than the
incredible.
other side. So come sit in your chair again and you test it.
Wow, and then the front too.
Yeah. And that one actually goes behind your ear.
Wow.
So it goes better than this side.
And it's not even tense when I get it up
Yeah.
here or anything.
Yeah, so now do this side. See, that one's not as good.
Yeah.
Do you see? So we have to, this is the good side, but we have to do a little on this side.
So even my good side's not that good.
Yeah, so the bad side surpassed the good side within a matter of a minute or two. And now I'm up here in a horrible spot. Here, spin around. This is a bad spot right in there.
Oh yeah.
Good. And now we're gonna just do the same type of thing. Turn towards the camera. You could drop that arm. We're gonna lift here on the collarbone. We're gonna come across on the spine of scapula from lateral to medial. We're gonna push down on the head of the humerus, creating a little space. And now do this arm, comes all the way behind.
Wow.
So here, turn this way. All the way behind. And that's a full range of motion for most normal people. You do it.
I had no
Normal
idea.
meaning like Cirque du Soleil is gonna have a better range of motion,
I had
right?
no idea they were supposed to move back this far.
So lie on your back, we'll set it now so it holds for a long time. And yeah, so your arm should come behind, and yours is only coming to about here comfortably. And now we got them to match.
Oh,
There goes the
yeah,
front
I
one.
felt that.
Good. Now sit up, we're gonna have you do something different. And because the left side was the bad side, you also have a tight spot here under the occiput. So I'm gonna tilt your head a little bit.
Oh,
Got it.
oh my God. That felt amazing, actually.
Now try the arm. Try
I
it.
feel like I could send this thing the whole way 360
Yeah,
at
yeah.
this point.
Really
That's
nice,
incredible. Yeah.
right? Good. So now lie on your back.
Oh.
And scoot down this way now.
Oh.
Those are a little tighter.
Oh yeah, I felt that. I might fall asleep here, I feel. Oh. Oh. Good. Oh.
Good, lie on your side facing me this way. Bring this knee up. This comes down. This comes this way. Big breath in. So this is going to be for your left lower back, right? Remember
Yep.
that?
Mm-hmm.
Big breath in and blow it out. And let this jiggle like this.
Oh. Wow.
Got it. And come back this way. Shoulders this way.
Oh. Oh.
Got it. Good.
Feels so good.
Now come stand up and try it out, okay? You're going to touch your toes, bend back, see how you feel, okay?
This is the lowest I've been able to go before.
So it's nice, right?
Even when I bend back, you don't get that little tenderness from like the. I feel like I'm 16. This is incredible. I haven't been able to touch my toes in forever. Thank you so much. This is like
It's good,
life-changing.
right? Now we're going to do the CFR next. And I'll talk you through it, okay? So whenever you're ready, open your mouth, take a breath and close. That cracked.
Oh,
You could hear that crack, right?
yeah, I felt that crack. Oh, wow. It's like instantly clear.
So point to where you felt it.
I felt it like up here.
Yeah, that's where I
Yeah.
felt a crack.
Yeah.
And it made a pretty loud noise,
Yeah,
right?
really loud crack.
Yeah. A lot of times I can't hear it, and hey, no, she's okay. But then that time I was able to really hear it.
Yeah. Oh,
And the
wow.
reason I can't hear it a lot is because it's muffled inside the face. But his was so loud, I heard it right through his face.
Yeah.
You heard it, right?
I heard. Yeah, I heard it. I felt it.
Yeah. So here's the other side, okay?
Okay.
Whenever you're ready, big breath in and close your lips.
Oh. Yeah, I felt that one too.
That one hit the back of your throat.
Yeah, that one did. Oh my gosh, I feel like it is so clear now. Oh wow, I've never been able to breathe like this before.
Good.
It's like completely not blocked at all.
Is that cool?
Yeah, that was incredible.
Now, our average person needs 5 to 8 treatments, but this is, you're gonna get, I think you're gonna get a lot just off this first one.
That's incredible.
Just breathe in one more time. It's good, right?
Yeah, I didn't know I was supposed to breathe in that much or like get that much air in each breath.
Now, did the second side crack too? I couldn't hear that one.
It did crack, not as
Yeah.
much as the first one, but you
Yeah.
could still feel it crack. And
Yeah.
then, yeah, I could get the balloon in the throat a little.
All right, man. Thank you so much.
Wow, thank
I
you so
appreciate
much.
it.
That
Yeah.
is life changing.
All right, thank you.
Oh,
Got it.
oh my God, that felt amazing. Actually,
Now try the arm.
I feel like I could send this thing the whole way 360
Yeah,
at
yeah.
this point.